morning, Honorable Member of Parliament, Dr. Sudashani Pananpule, Director Mental Health, and the Deputy Head of the WHO, and Dr. Tim and his colleague from Autism Speak, and the Director of Primary Education, our friends, and everybody who are invited as special guests, and my media colleagues and parents. I'm Dr. Rathnasiri Hewage, Director of Ridgeway Hospital. I told that because one day I was walking in the roadside and somebody came to me and told that you are just like Dr. Rathnasiri, Ridgeway Hospital Director. But to come to you only, I realized that you are not there. So I generally try to tell that I am Dr. Rathnasiri Hewage. So, ladies and gentlemen, what is the chance of a person who is exactly the same can born in this universe? Say, for example, another Dr. Rathnasiri Hewage will be born somewhere else in the world. What's the chance? Chance is 1 in 400 trillion. 1 in 400 trillion. So it's impossible to have a same person, practically impossible. The other thing we realized that so we share the genome of Homo sapiens. The scientists, they study the genome. They say human beings are genetically similar in 99.9%. Two contradictory statements. One say, there cannot be one person. The only chance is 1 in 400 trillion. The other one says, human beings all are genetically more or less same. So then, we find this difficult. How can this happen? How can one become 1 in 400 trillion, genius kind of person? That is because, Madam, that's the name, Madam. Now this is the interpretation. You interpret the Constitution. Your opposition MPs also interpret the same Constitution in different ways. So our genome is there, but the interpretation and the environmental factors make them to be different. Now, I also thought before coming to this hospital, I thought it's autism. It's a rare disease. Dr. Samanmali wanted me to give her a room. I just asked, Samanmali, how frequent is this disease? Because I don't have anybody, known to me autism. Then only I realized, and they explained, Professor Hemamali, when they explained to me, it is in US, 1 per 88. In Sri Lanka, 1 per 90. In her study. So, you have ASD, Autism Spectrum Disorder children, 1 per 100. 1 per 100. So, at the moment, this hospital treats nearly 1,000 patients. So 1,000 has 10 hundreds. At least non-diagnosed 10 patients will be here. And you know that when you have ASD or some spectrum of diseases, you are more prone to get other diseases. It's proven fact. The literature says that. So then it should be more than 10. The other factor is the primary caregiver is the mother. The research has shows that the mother who is caring autistic or the ASD child tend to get more problems. So we treat patients here, but we communicate with mothers. So what is the solution? This is Ridgeway Hospital is the national premier tertiary care hospital of the country, and we are trying to become the best hospital in Southeast Asia before 2020. So what is, I want to tell you our strategy to meet this gap. We started recently, about 1 year ago, we started a program called Child Friendly Retreat Project. It has 3 main objectives. First one, to make available the best services available in the area, in the region, so that our children will not go to Singapore, India, Thailand for treatment. The bone marrow transplantation, soon we will start bone marrow transplantation in this hospital. We will conduct the liver transplantation here. So like, physically we don't let anybody to go out. The second one is to make this hospital child friendly, happiest child friendly hospital. And recently we got a donation from China. It has more than 1,000 million project. When the state secretary came to this hospital, she said, we'll build the hospital in child-friendly way. She hasn't seen the VGT hospital, which is 2,000 bedded hospital in China. It's known to be the one good hospital. It's not like child-friendly like this hospital. So the second objective is to make the hospital child-friendly appearance. The third objective, which covers your interest, is the communication objective. The children are different. Children are different. Mothers are different, but mother with a sick child is different. And mother with an autistic child is a totally different person. We have to empathize. We have to understand their point of view. So the third project, we have already started to make our staff aware, and they make them competent to communicate, so that the patients and the mothers, they feel confident and they follow what we say. So that is the most important part, I think, because Honorable Madam said, no, that most of the complaints we get about the health sector, this is only country where nobody is not admitted because of lack of beds. We never send them out, this country. Everything is given. Doctor saying if you get sick today, you can go and take treatment and go without paying anything. That's the care we give. But people criticize health sector because our communication is not good. That's the problem. It's obvious. You can't treat nurses. How can they treat 100 patients at a time without good communication? But that can. We know how to do it. We are in the process of doing that. So I am very much happy because I was fortunate to give Sri Lanka Association for Child Development this hall to inauguration, and our secretary was the chief guest here, and Dr. Mehta was here, and I am very much happy as the director of this hospital, the way you are progressing, madam. We are very thankful, and the resources we have given is, I think it's meaningful. Is money, value for money is there. So I'm not going to take much time, and I want to tell you that as the director of this hospital, we will take this fact, the availability, the existence of 1 per 100, basically 1 per 100 children autistic or HD syndrome. So, it's a significant thing for us, and we are taking care of them. And I want my media colleagues, because they are very helpful to LRS, and please help us and please help them also and get this message going and spread the message, and then develop this hospital and to take care of our children of the nation. I thank you again. Thank you very much.